Let's come back to exercise with fasting. Let's talk about types, because exercise can include a lot of different things and different intensities. So what type do you recommend for people during a fast, an extended fast, and how often?
So, exercise is really, really important. We know that. There's two kinds. Let's cut to the chase. There's two kinds. There's aerobic, and then there's high intensity interval training. I am all about HIIT or modified HIIT. Call it whatever, give it all these names. But basically, look, the long and short of it is this: intense short burst of activity with intense rest. What does that mean? That means you do a short burst of activity at the highest, fastest rate and most that you can do for about 45 seconds, maximum a minute, and then just stop and rest completely. And why do I do this? Why do I advocate? Why do I do that myself also? Because, again, it comes down to those generations and generations of humans before you. They ran away from danger. They ran away from danger and hid behind the tree or the rock, or they quickly swam across the river to get away from the crocodile. But they didn't keep running and running and running and running and running, because they'll be caught by the saber-toothed tiger and killed already, right? From the physiological standpoint, when you're constantly running like that, you're producing a lot of reactive oxygen species and lactic acid and other types of chemicals in your body, from your muscles. And that constant production of an inflammatory substrate and your inability to produce antioxidants, the free radical scavengers, is a problem. Our rate limiting step is our ability to produce superoxide dismutase, glutathione. These are anti inflammatory redox capturing molecules. It's a rate limiting step. So if you're constantly exercising too much and keep running and running and running, you do yourself some harm. So, for example, I'll give you an example. My marathon runners, in general, they have more atherosclerosis, more coronary calcium, more inflammatory markers, and yet they're running miles and miles and miles a day, and they lean and they come in my office, but they have coronary disease. So I'm always skeptical about that type of lifelong exercise. But I do like sprinters. I do like HIIT for that reason. And I have practically seen it in my clinic, where my people who go to the gym and do HIIT, when I analyze them, their inflammatory markers, their CRP levels, their interleukin 6 levels are much better than my marathon runners, who have higher inflammatory markers and they have more coronary calcium. So, inflammatory markers are a surrogate, because if you do some exercise, interleukin 6 first is released from the muscles, but then it comes down again nicely. But it's a surrogate for what's going on. What's the final thing that I'm interested in? I'm interested in your coronary calcium. Because if your calcium score is high, you got coronary disease. You're going to die of coronary artery disease. And if it's going up and up and up and up, now I'm really unhappy, because that means your burner's on. You're still cooking inside, right? So my view on exercise is you should stay fit. You must stretch, because I think stretching is really important, because stretching changes your muscle as well, makes them longer, thinner, leaner. And also, you must do HIIT on a daily basis, short bursts of activity with intense rest. The intense rest gives your body a chance to clean up the mess you made. That's why I like HIIT. But if you think you're going to get on that treadmill and run for an hour and a half continuously, I think you're going to have a problem. You'll have more joint pains, more problems with inflammation in your body. So I don't. Now, during a fast, you should do HIIT. You should do resistance exercises. I like resistant exercises and HIIT. Resistance exercises means flow exercises. Look, everyone can do this. You basically lie down, you do a plank, you do a side plank, you do leg lifts, you do sit-ups. I like that, because that's going to give you flexibility, you're stretching at the same time, and you're doing resistance using your own body weight to create the resistance. And now that stimulates bone. Okay, so you're less likely to get osteoporosis, osteopenia, and you build up muscle at the same time. To build up muscle, you need resistance exercises. So squatting, sit-ups, all these things. And as you get older, you need more muscle. I told you, because if you fall, you're in trouble. If you break your hip, you're in real trouble. So stay strong and be as muscular as you can. Of course, you got to do exercise. So during a fast, you should do some HIIT and some resistance exercises. Don't get on that treadmill. I'm not too fun. Treadmill's fine if you're going to be doing a triathlon and you need some endurance, or you're getting ready to do some heavy-duty skiing and you want endurance. That's a great thing to do for endurance purposes. But once it's over, it's done. Yes, you'll be able to stay on the slopes longer and you're less likely to fatigue and all that because you did all that. That's wonderful. But it's not a long-term strategy. It's a short-term strategy. And that's what I encourage on my patients. It is important, though, and I'm glad that you brought it up.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
The king of all hormesis is fasting. Doing time-restricted feeding on a daily basis should become part of your life. Stop snacking. It's unnatural. You should only have 2 meals a day in a 6-hour interval.